My name is Tina Gustafson, and I am the Environmental Health Specialist at the Lawrence-Douglas County Health Department. We look at public pools to make sure the public is safe, make sure everything's being conducted at the same level, and people are being safe and being prepared. We have about 95 pools, so we do at least 95 inspections every month. And that does not include re-inspections where we have to close a pool down and go re-inspect it to reopen it. Once we get to the pool area, we look for different safety features. That includes a buoy with a rope attached to it that's about 1.5 times the length of the pool, so we can throw it out and be able to pull somebody back. We look for a shepherd's crook, usually in a very visible location for people to access. We make sure it's visible from the top at the deepest end. If it's not, it poses a safety risk. If anybody falls in, we would be able to see them at the bottom. So we test the water quality for chlorine levels, and we look at pH and temperature. And so those have to be within certain ranges to be able to pass the inspection. So if the chlorine levels are really low, it means there's not enough disinfectant in the water, and it means it's not cleaning and disinfecting the way it needs to be to make it a safe swimming environment. pH kind of plays into that as well. There are a lot of factors that go into swimming pools, and we only test for pH and chlorine. If you see a pool and it's looking green or cloudy, don't get into it. It's probably not where it needs to be for safety levels. If you see any broken glass around, be wary. There could be some in the pool. If you are sick, we don't recommend getting into the pool. It can transmit the disease and be pretty communicable. Everything looked great at this pool today. All the inspections are drop-in based, so we do those sporadically throughout the month, unscheduled typically, and we like to chat with the manager or somebody on site if there are any problems. If we do need to close the pool down, we typically put up one of our big red signs, and it is actually a misdemeanor to take it down. I think having a safe pool environment across the board makes it more equitable because there are different pools all across the city and the county depending on where you live. And to have the same standards is important to keep that equity component. The other thing, as far as equity goes, a lot of these pools need to be ADA compliant. And so that typically means an access point, either a ramp or a chair to be able to lower it and lower somebody into the pool, and be the most inclusive as possible so everybody can enjoy using the public pools.